of market freedom. It's made health insurance more comprehensive. I talked about that with you. But it's failed at certain things. Health insurance remains expensive. Between premiums, copays, and deductibles, it's very expensive. It's the main reason why people don't carry insurance, is because it's too expensive. The healthcare system remains complex and confusing. You have all these different health insurance plans, rules, regulations, etc. It's difficult to negotiate. Whoop. Let me go back. There's one more piece. If you like your plan, you can't always keep your plan. Now, this goes back to 2010, and Obama was raked over the coals for this. He said to a national audience that when this new Affordable Care Act is enacted, if you like your insurance and you like your doctor, you can keep them. Turns out, not quite true. Certain insurance policies that did not meet the standards that were set by the Affordable Care Act could no longer be sold. So those consumers had to get different insurance plans, and the companies offered, the new plans with better features, more coverage, but the premiums would be, of course, more expensive. You might not be able to keep your doctor if your doctor was not in the network of the new plan that you got. So that was an issue. It's too soon to tell. We don't know if the law made America healthier. The way we'll know is going to take years to find this out. The idea is, by making health care more accessible, more Americans will use it, and will use it more routinely. As such, as a result, I should say, Americans should get healthier. But that remains to be seen. Let's see what the Pew Center tells us. From 2017. For the first time, more Americans say 2010 healthcare law has had a positive rather than a negative impact on the United States. Let's make this a little bit bigger for you. Okay. All right, so we see here 2013. All right. We had 24% of Americans said that the law had a mostly positive effect on the country as a whole. 31% said it had not much of an effect. 38% said it had a mostly negative effect. We fast forward that to 2018. 14% not much of an effect. 35% mostly negative. 44% mostly positive. So people now support the law much more than they did in 2013. When you had about a quarter, now you're up to nearly a half. It's become popular. I'll be honest with you, for most Americans, the effect of the law has been minimal. Because for most Americans, you get your insurance through your employer. That's 46% of Americans get their insurance through their employer. Employer plans have not been affected much by the Affordable Care Act, except to say that you now get preventive care at no out-of-pocket costs. So those mammograms, those colonoscopies, for women, birth control pills are available at no cost. Flu shots for people with health insurance are free. Pneumonia shots are free, nothing out of pocket. Doesn't affect your deductible. There can be no copay. But other than that, the effects have mostly been positive for people who do not get their insurance through their employer and who are not particularly well off. They have had great positive impacts. Most people say not much of an effect on their own family, and then the mix there. Let's go back. Republicans, however, the effect on the country as a whole, nearly 2/3 of Republicans say it's been mostly negative. Not surprising, and I'll give you some reasons why a little bit later on, why that is so. Democrats, the opposite, mostly positive. 2/3 of Democrats say it's been mostly positive. Nearly 2/3 of Republicans say it's been mostly negative. Not surprising. So perceptions vary. Know the facts and then draw your own conclusions. Voters in Idaho, Nebraska, and Utah approved ballot initiatives to include Medicaid programs, to include in their Medicaid programs adults with incomes up to 138% of the federal poverty line. They've expanded their Medicaid. In addition, Maine voters elected Janet Mills as governor, clearing the path for a Medicaid expansion that voters approved by referendum. A referendum is a direct vote by the voters a year ago. And this is the results from the 2018 midterm elections. All right. Healthcare costs in cross-national perspective. Here we want to take a look at all the countries that you've seen in sicko and in sick around the world. And we want to compare you now have a sense of the benefits, the health insurance benefits, the level of access to health care that people in those countries have. And we want to get a sense of how much that costs them compared to what it costs us in the United States. And we want to get a sense of the health outcomes. We're going to look at things like life expectancy, child mortality, things of that sort, to get a sense of what the facts of the matter are in those countries. That's the website I went to. Feel free to go there and check it and make sure I'm not trying to mislead anybody. I hope you wouldn't think I would ever do that. But I have had some people accuse me of that in the past. Go and take a look at the data for yourself. And it's what I'm going to be presenting to you is all there, and a whole lot more if you want to dive into this in greater detail. So it's the World Health Organization. I literally earlier today went to the site and got the latest data from the World Health Organization. That's why I put 2020. Well, the data you'll see is not from 2020, but it was at the website today. All right, so you visited the United Kingdom twice. Michael Moore took you there, right? Remember, how much did you pay for that baby? Michael Moore took you there, and you went there also in Sick Around the World. And we want to compare that to the United States. I'm going to back up a second. Before we start this, here is your 10th opportunity to earn extra credits. Extra credit, I should say. So I'm going to give you another phrase, and you are going to type it into an email and send it to me. And the phrase is this: from Saturday Night Live, van down by the river. All right, so now we're going to compare the United Kingdom to the United States. I'm going to walk you through this, and then you can analyze the other data on your own. Gross National Income Per Capita, PPP International. Let me explain. Gross National Income Per Capita. Per capita means per person. Comes from the Latin per head. Per person. You total up all the income in a country, you divide it by the population size, and that's income per capita. It's an average, not a median. So these are going to be a lot higher than median incomes would be. Remember, because of income inequality. So keep that in mind. But we are interested in here, and using this, the reason why I include this, is to give you a sense of the relative wealth of each country. PPP International. So what that does is it takes British pounds and American dollars and standardizes them into what's called purchasing power parity. So what's the purchasing power in Britain? What's the purchasing power in the United States? We're going to make those pounds, those dollars, the yen in Japan, the euros in Germany, we're going to make them all comparable to one another so that we can look at these figures and get a sense of the relative wealth of each country. So for Britain, it's 35,760. The United States is much wealthier, 53,960. These data come from 2013. I put the year that the data is from on the United States side, and I highlighted it in red. So it's whatever's on here, whatever year is here, also applies to the country that we're comparing to. Life expectancy at birth for males and females. So a baby boy born in Britain is expected to live 80 years. A baby girl born in the United Kingdom is expected to live 83 years. That's from 2016. You notice in the United States, it's significantly lower. A baby boy is expected to live 76 years, a baby girl 81 years. So the British will live longer than Americans do. Healthy life expectancy. The Brits are expected to live 71 healthy years. Americans, 70. It's lower, and that's from 2012. Probability of dying under 5 per 1,000 live births. This is the child mortality rate. Infant mortality, I know I've mentioned that in class. That's a child dying before its first birthday. Child mortality is a child dying before its 5th birthday. And it's reported as a rate per 1,000 live births. In Britain, it's 4. In the United States, it's 6. It's 50% higher in the United States than it is in Britain. So children are more likely to die before their 5th birthday in the United States than they are in Britain. And think about how these things are impacted by access to health care. Also keeping in mind that health outcomes are impacted by things other than access to health care, like things like violence in a society, accident rates, air pollution, that kind of stuff as well. But certainly access to health care and quality of health care is going to have an impact on these health outcomes. Probability of dying between 15 and 60. So these are years where people should live, right? Between 15 and 60. You've gotten over the childhood problems. You are not yet elderly in Britain, and this is for males and females. 81 out of 1,000 men between the ages of 15 and 60 are expected to die. And for women, it's 82 out of 1,000 women between the ages of 15 and 60. In the United States, it's 142 and 86. We can expect 142 out of every 1,000. That's 14% of every, no, I'm sorry, that's 1.4% of men in the United States between the ages of 15 and 60 to die. For women, it's 86. Much more, and this is data from 2016, much more likely in the United States than it is in Britain. The total expenditure on health per capita, using that PPP International so we can compare the numbers, the dollars, the costs. 3,377. In the United States, 2014. The United States, 9,413. Now, understand something. You saw what the British get. The British have a fully socialized system, the National Health Service. They go to any doctor, any hospital, any pharmacy. It costs them virtually nothing out of pocket. And it costs, in order to provide that level of care with no out-of-pocket expenses, $377 per person. In the United States, where we provide much less access, it's $9,400 per person. It's triple, nearly triple the cost. The total expenditure on health as a percentage of GDP, gross domestic product, the total value of everything produced in a nation, in a country, in a year. So for Britain, providing all that to their citizens is 9.1% of GDP. The United States, it's 17% of GDP. This was in 2014. So we're paying a lot more, and we are getting a lot less. And it shows in terms of health outcomes. And people in Britain aren't going bankrupt because of medical bills, because they don't have medical bills. That was a point that was emphasized over and over in the second film, Sick Around the World. Updated, this is from CMS, the Centers for Medicaid and Medicare Services, federal government. In 2016, the United States spent, not the government, not just the government, all Americans spent $3.2 trillion on health care. That's nearly $10,000 per person, and it's 17.8% of GDP. No other nation on earth spends nearly as much per capita, nor nearly as great a percentage of GDP on health care as does the United States. Ask the functionalist question. Ask the question that conflict theorists would ask. Is this system functional? If it's functional, it's our healthcare system. That would mean that our system is geared towards protecting people against disease, expanding their life expectancy, and so forth. It doesn't seem to be working in the United States, our system, as well as the British system is working. Take it from the conflict perspective. Who benefits from this $3.2 trillion? Where is it going? Lots of it is going to pharmaceutical companies. Lots of it is going to insurance companies, and to the people especially that are heavily invested in insurance companies, health insurance companies, and in pharmaceutical companies. So those are the undeniable facts. Let's compare it. Canada, the United States. You can look at these numbers yourself, go through them. The Canadians aren't as wealthy as we are. They're expected to live longer. They're expected to live a longer, healthy life. They have lower child mortality. They have lower adult mortality. They spend less per capita than we do, about half of what we spend, and they spend much less as a percentage of their GDP. That's a similar system to Medicare for all is what the Canadians have. So the two of the most highly socialized systems are in Canada, which has a single payer health insurance system, and Britain, which has a fully socialized system. The government owns the hospitals. The doctors, nurses, and medical providers are government employees. The government pays for them to go to medical school and so forth. They don't have to pay premiums for malpractice insurance. All of that is covered by the government. The United States compared to France. France has private health insurance. The French system is very much like the German system that you saw in Sick Around the World, with the exception, the difference being that the government pays the premiums. And just like Britain and Canada, they're not as wealthy as we are. They live longer. They live a healthier life. They have lower child mortality, lower adult mortality, and they spend much less per person and as a percentage of GDP on healthcare. Cuba, a third world country, income of a fraction of that in the United States. Life expectancy is a little bit longer. This is a third world country. Healthy life expectancy at birth is shorter. Child mortality is lower. It's lower in Cuba than it is in the United States. Adult mortality is lower in Cuba than it is in the United States. Expenditure per capita is a fraction of the United States, and as a percentage of GDP, it's much less. I can tell you this, after going through the numbers and comparing them with the previous numbers that I had from 2012 in terms of adult mortality, the United States is the only country I saw where these numbers have gone up since 2012. And what researchers tell us is the reason why these numbers have gone up, the numbers of adult mortality have gone up in the United States, is because of what's called deaths of desperation, related to alcohol abuse, drug abuse and drug overdoses, and suicides. You find these things at higher rates in the United States over the last several years than you do in other places. So is it directly related to the health insurance system? No. Is it related to a number of things that we've seen throughout this semester about how we have levels of inequality based on income, based on wealth, based on race, based on ethnicity, based on gender? Yes, there are those kinds of connections. The United States compared to Germany, Germany not as wealthy. They live longer. They live a healthier life, a longer, healthier life, have much lower child mortality, much lower adult mortality. They spend less per capita and less as a percentage of GDP. Japan, same thing. All right, take a look at the numbers, you'll see the same thing. Look at their child mortality. It's 2 out of 1,000. The United States is 3 times higher. Life expectancy is much greater, etc. And they spend very little on health care, 10% of their GDP. And then